Stinky dental floss? Tips to solve it. Did you know that dental floss is much more important than just removing food particles stuck between your teeth? Today, we will uncover the importance of this essential practice for oral health. Want to discover how dental floss fights plaque and prevents gum disease? And why the bad smell on dental floss can be a warning sign for your oral hygiene? We'll also explore effective techniques for using dental floss correctly to ensure a healthy smile. Stay with us and learn how to maintain impeccable oral hygiene. Using dental floss. Using dental floss is an essential practice in maintaining oral hygiene and overall health of teeth and gums. Contrary to what many think, dental floss is not just for removing food particles stuck between teeth. Its main function is to remove dental plaque, a sticky and colorless film that constantly forms on the teeth. This plaque consists of colonies of bacteria that, if not removed, can cause cavities, gum disease, and bad breath. Dental plaque starts to form right after brushing and, within 24 hours, can harden and turn into tartar, which can only be removed by a dentist. Therefore, it is crucial to use dental floss at least once a day to prevent plaque buildup and maintain oral health. Dental floss should be carefully passed between all teeth, reaching the gum line where the toothbrush cannot clean adequately. To ensure effective plaque removal, it is important to use the correct technique when flossing. The floss should be inserted between the teeth and, with a gentle back and forth motion, taken to the base of the tooth, making a C-shaped curve around each tooth. This allows the floss to clean both the tooth surface and the area below the gum line, where plaque can hide. Additionally, it is important to use a new piece of dental floss for each space between the teeth to avoid transferring bacteria from one place to another. Regular and correct use of dental floss helps prevent serious oral problems, keeping teeth and gums healthy. Adopting this daily practice, combined with proper brushing and regular visits to the dentist, is fundamental for good oral hygiene and a healthy smile. Bad smell. When using dental floss, one common problem many people face when using dental floss is noticing a bad smell on the floss after use. This unpleasant odor can be alarming, but it's important to understand why this happens and what it means for oral health. When you floss between your teeth, it removes plaque and food debris trapped there. Dental plaque is a film formed by colonies of bacteria. These bacteria, when metabolizing food residues, produce volatile sulfur compounds that have an unpleasant odor. Therefore, the bad smell on dental floss indicates that there is plaque and food debris accumulation between the teeth. Although the smell on dental floss can be unpleasant, it does not necessarily represent the smell of your breath. Bad breath, or halitosis, is caused by volatile compounds that are easily released in the breath. Dental plaque, when present on the teeth, does not significantly release these compounds into the air unless there is significant buildup and conditions conducive to the release of these odors. If a particularly strong smell is noticed in a specific spot when flossing, it may indicate the presence of a localized problem, such as gingivitis, gum inflammation, or even an early-stage cavity. In these situations, oral hygiene should be intensified by brushing more carefully and using proper flossing techniques. In summary, the bad smell on dental floss is normal and indicates the removal of residues and plaque. Maintaining good oral hygiene and using dental floss correctly are essential to prevent more serious problems and ensure a healthy mouth. Proper oral hygiene. Maintaining proper oral hygiene is fundamental for the health of teeth and gums, and it goes beyond just brushing. The combination of correct brushing, flossing, and additional techniques is crucial to avoid oral problems such as cavities, gingivitis, and bad breath. Proper brushing should be done at least twice a day using a soft bristled toothbrush and fluoride toothpaste. The brushing technique is important. The brush should be positioned at a 45-degree angle to the gums and moved gently back and forth in short circular motions. It is essential to brush all tooth surfaces, including hard-to-reach areas like the inner surfaces and molars at the back of the mouth. Flossing is a vital complement to brushing as it removes plaque and food debris that the brush cannot reach, especially between the teeth and below the gum line. To use dental floss correctly, cut a piece approximately 18 inches long, wrap the ends around your middle fingers, and use your thumbs and index fingers to guide the floss between your teeth, forming a C-shaped curve around each tooth. In addition to these basic practices, using antibacterial mouthwashes can help reduce plaque and combat bad breath. Replacing your toothbrush every 3 months, or when the bristles are worn out, is also important to ensure effective brushing. Regular dentist visits, at least twice a year, are essential for professional cleaning and early detection of any oral problems. By consistently adopting these oral hygiene practices, it is possible to maintain healthy teeth and gums, prevent diseases, and ensure a beautiful and fresh smile. Specific tips to reduce bad smell. Dealing with the unpleasant smell that can arise when using dental floss can be challenging, but there are several effective strategies to minimize this problem and maintain impeccable oral hygiene. Here are 3 main tips to reduce bad smell when flossing. Proper brushing. The first tip is to brush well the area where the bad smell is most intense. Often, these areas may have plaque buildup or food particles that were not adequately removed. The brush should be positioned at a 45-degree angle to the tooth and gum, with gentle vibrating motions to allow the bristles to penetrate the gum sulcus. Proper brushing helps reduce the amount of debris that can cause bad smell. Correct flossing technique. The second tip is to ensure the dental floss is used correctly. This involves inserting the floss between the teeth, making a C-shaped curve around each tooth, and moving it gently up and down. Many people simply place and remove the floss, which is not sufficient to remove all plaque and food debris. Using a clean piece of floss for each interdental space is also crucial to avoid transferring bacteria from one tooth to another. Use of special products. The third tip involves using specific products, such as floss impregnated with antibacterial agents or mouthwashes. An example is Oral-B Superfloss, which has a sponge-like section that can be moistened with bactericidal sprays. This provides both mechanical and chemical cleaning, killing bacteria and removing debris more effectively. By adopting these practices, it is possible to significantly reduce the bad smell when using dental floss and maintain excellent oral hygiene. If the problem persists, it is advisable to consult a dentist to assess the presence of more serious problems, such as tartar or cavities. Signs of more serious problems. Although regular oral hygiene practice, including correct flossing and proper brushing, resolves most bad smell-related issues, there are situations where these methods are not sufficient. When the bad smell persists, even after following all oral hygiene guidelines, it may indicate more serious problems that require professional attention. One of the most common causes of persistent bad smell is the presence of tartar, which is hardened plaque strongly adhered to the teeth. Tartar cannot be removed with regular brushing and flossing and requires professional cleaning by a dentist. Tartar buildup can cause gum inflammation, known as gingivitis, which can also be responsible for bad smell. Another possible cause is untreated cavities or restorations with infiltration. Untreated cavities can harbor bacteria that produce unpleasant odors, and poorly adjusted restorations can allow the entry of food and bacteria, leading to similar problems. A detailed evaluation by a dentist can identify and treat these issues. Additionally, problems such as poorly adapted crowns or poorly fitted prostheses can also contribute to bad smell. These devices can create areas where food and plaque accumulate, making proper cleaning difficult. If after following all recommended oral hygiene practices for a few weeks, the bad smell still persists, it is essential to schedule a dental appointment. The dentist can conduct a complete evaluation, including X-rays, to detect hidden problems and provide appropriate treatment. This professional intervention is crucial to ensure oral health and eliminate any persistent source of bad smell. Therefore, maintaining good communication with the dentist and having regular checkups are vital components for maintaining good oral health and preventing more serious problems. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.